So Dr. Leah Susser is a reproductive psychiatrist and an assistant professor of clinical psychiatry at Royal Cornell Medicine. Her clinical work, academic work, and teaching focus on increasing access to mental health care for women across reproductive stages, including women with symptoms across the menstrual cycle, in the perinatal period, and during the perimenopausal transition. And she has created a specialized reproductive mental health clinic within the New York Presbyterian Hospital, Westchester Behavioral Health Center, outpatient department. And today she will be talking to us about premenstrual symptoms. So thank you, Leah, so much for being here.
Great. So what I'm going to do is I'm going to just present for a few minutes on what premenstrual symptoms can be. And then we discussed how this will be very kind of informal and we can have discussions about any sort of topic that I bring up that you'd like to hear more about, answer any questions. We could do case discussions, whatever would be most helpful for everyone here. So let me share my screen. All right, can everyone see it? All right, great. I think someone's not muted. I don't know if it's possible to mute that. Okay, great. So just to give some background on premenstrual symptoms before we open this up for discussion, there are different types of premenstrual symptoms, and it's really important to distinguish them to know when women are getting symptoms and how to treat those symptoms. And so I'm going to just go over what premenstrual dysphoric disorder, premenstrual syndrome, and then premenstrual exacerbation of underlying disorders are. Now, premenstrual dysphoric disorder, or PMDD, and premenstrual syndrome, PMS, are related disorders. So just different organizations call it different things. And PMDD is kind of like a subset of PMS. And those two are luteal phase disorders. So what that means is in this picture down below, you can see the menstrual cycle divided between the follicular phase and the luteal phase. At the beginning of the follicular phase, the woman menstruates, she bleeds. And then between the follicular and luteal phase, a woman ovulates, and then she enters a luteal phase. And later in the luteal phase is the main period of time when women with PMS and PMDD have symptoms, though it can be spread across more time. But the key is that women with PMDD and PMS also have a period of time in the cycle when they either have no symptoms or minimal symptoms. Sometime in the follicular phase, often shortly after menstruation, is the time where it's most common to not have any symptoms. So the key is that these women do not have symptoms all across the cycle, but really their symptoms are focused in the luteal phase, and there's a period in the follicular phase when they don't have symptoms. Now, premenstrual exacerbation of underlying disorder, or PME, is different in that the women have symptoms across the menstrual cycle, but the symptoms are worse premenstrually. So an example could be a woman in a major depressive episode who's feeling depressed throughout the month, but the symptoms are exacerbated. They're worse in the premenstrual period. And the treatment is different for these. And so it's important to distinguish them. And in fact, the majority of the women I see who come in thinking they have PMDD, when we prospectively monitor their symptoms, often they're really experiencing PME. So to get into a little more detail on what these different disorders are. So once again, PMS and PMDD are overlapping terms, just different organizations call it different things. PMS, for example, is a term used by ACOG, so OBGYNs often use this term. And for PMS, you need to have one mood or physical symptom. But you can't just have the symptom. The symptom has to be significant enough that it affects functioning. Most women experience at least one premenstrual symptom. Many of those women, it's not significant enough to affect functioning, but just that's how common premenstrual symptoms are. About 10% of women have moderate or severe symptoms premenstrually. PMDD is a term used in the DSM and now in the ICD-11. And in the DSM, to have a diagnosis of PMDD, a woman needs to have at least 5 premenstrual symptoms. And once again, there needs to be a period of time in the menstrual cycle, often part of the follicular phase, when a woman has no symptoms or minimal symptoms. And these premenstrual symptoms, once again, need to affect functioning or cause distress. And about 3 to 9% of women experience PMDD. And I'm going to go over very briefly why women experience PMS and PMDD and how you treat it. But I first just want to go into a little more detail about PME, which we know a lot less about and has been studied a lot less, unfortunately, and only more recently really recognized. So PME is when a woman has another underlying condition, a mood disorder or an anxiety disorder or OCD, and it worsens premenstrually. Most women with mood disorders get this worsening premenstrually. And often the depression is what worsens premenstrually. You can have worsening of or exacerbation of hypomania across the menstrual cycle as well. In terms of anxiety disorders, this is much less studied, but there's evidence that generalized anxiety disorder, OCD, and social anxiety disorder can have premenstrual worsening in certain women. In OCD, many women can actually experience this premenstrual worsening of the OCD. And there's evidence that women who have premenstrual worsening of OCD have different features than the women who don't. For example, women with premenstrual worsening of OCD have more likely to have suicidality, for example. But we know much less about the treatment of PME. It's been studied much less. However, there's some evidence that the treatments for PMS and PMDD may not work for PME, and some other evidence that if you treat the underlying mood disorder, you can treat the premenstrual worsening of symptoms. And so really when you're getting this premenstrual worsening of symptoms, it's a sign that the underlying disorder is not treated. And if you treat that better, you may be able to treat the premenstrual symptoms better as well. But it's very much understudied. So why do some women experience PMS or PMDD? So, many women will come see me and say, I have PMDD, check my hormone levels. And what's really important is to explain to these women that their hormone levels are actually the same. We're not going to find differences in estrogen levels or progesterone levels. In fact, in women with PMDD and women without PMDD in the luteal phase, they experience this increase in progesterone and this decrease in progesterone with similar levels. However, women with PMDD are sensitive to these changes in progesterone. So when it increases or decreases, women with PMDD can experience changes in their mood or anxiety. And this is thought to be related to allopregnenolone, or also called allo. So progesterone is metabolized into allo. And so here in the luteal phase, you also get an increase and a decrease in allo. And women with PMDD can be sensitive to those changes, and those changes can trigger symptoms. And there's some evidence from drugs that have been studied for PMDD and PMS that if you either prevent that change in allo or if you slow it in the luteal phase, you can relieve some of the symptoms of PMDD. So what's the treatment for PMDD? So CBT can help PMDD. There are lifestyle modifications that can help PMDD, including exercise, sleep, stress management, calcium. And there are medications that can help PMDD, including SSRIs, oral contraceptive pills such as Yaz. And so here are my references. And then let me stop sharing so we can open it up for discussion.